So the first thing I want to start with is a clear understanding that this is a very surreal time in our lives. We're going to talk about this for the rest of our lives, this period. People have had crises for millennia, but we've usually been able to band together and be together. Unique characteristics of this crisis is that we are isolating. That's physically isolating. Socially, I want us to be together electronically as a team, because it's very important to remember that although this is what Hamlet called time is out of joint, it's a very surreal period. It's disorienting for us. We're very good at handling crises. We're very good at this. My last lecture a week ago, apparently everybody quoted back to me the one quote which was somewhat humorous, that we are very, very lucky because we live in a medium-sized city where people are socially conscious enough to isolate, to protect each other, as well as themselves, next to a monster hospital. And that monster hospital, meaning the scientists, the teamwork, the nurses, are what will get us through. And the medical system will get us through, not the politicians, but the medical. And we are that. Because it's very important to remember that in difficult times, we can be a time of fear or a time of greatness. Let us choose greatness. We're very lucky to have this team together, and it's important to know that if we work together, we will solve it. I'll explain how, I'll explain why, and I do wish to do that by putting a face on this disease and a face on the heroes that are fighting this. And by this, I mean you, and I mean the patients, I mean everybody, because you decrease fear and you decrease uncertainty by knowledge. And that knowledge is essential to people if we wish them to understand what we're fighting, how we will get through this, and understand what the predictions are and what makes sense. And what I want to do is explain where we are, where we've gotten to, and where we're going to be. This makes sense of the steps that are being taken here at the hospital and elsewhere. The first thing to understand is we can do this. We can get through this problem. The sun is still going to rise in the east here over the Indian Ocean. It's still going to set in the west here over Lake Mendota, and our days will go on. They'll be changed forever. But remember, this is a critical time. People's lives are at stake. But that's the sort of thing that we as a medical center are very good at. And we're lucky to be part of that medical center. Not so fortunate elsewhere in the world. Our friends in Nigeria, in Kenya, are at great fear because they do not have the medical systems that we do to support this. It's essential, therefore, that we come up with the strategies and the cures that will work worldwide. Put a face on the disease. This is the coronavirus, or at least a cartoon of it. It's an unusually shaped virus. It's an RNA virus, very simple. It has attachments, which are the corona or the crown. It has a glycoprotein coat, which is somewhat protective during its travel from cell to cell. And its interior is RNA. It takes over the genetic system of a cell that it infects, and it causes it to replicate itself at the expense of the cell it infects. It itself is ended when your immune system can find it, isolate it as foreign and remove it, or it runs out of vectors or sources to infect. Its ability to infect have everything to do with its infectivity, which is different for different viruses, its vectors, what can it grow in, and the conditions of which it grows in. Its mortality, morbidity has everything to do with the cells it infect and the importance to us, as well as our immune reaction to it. This is the face of the team that's fighting this problem. And believe me, it's us. We are the emergency response teams, the farmers, the grocery clerks, the people that clean up, the people that wipe the virus off the face of the planet with soap and water, the doctors, the nurses that are working in the ICUs, the clerical people who are doing the tracking of all of our patients, all of us. That's the team. That's the secret. That's the reason we will get through it. Our nurses are retraining. It's a frightening time for them. It's a frightening time for doctors. If you've been a neurosurgeon for 40 years and suddenly you become a pulmonologist, it's a little frightening. We can do this, and we will. We're just at the front end of this problem, but we are controlling it well. Our goal is, until we get vaccinations and effective treatments, is to decrease by 2/3 the people who are dying, or would have died without effective measures. And that means knowing what we're fighting and knowing why. So let's talk a little bit about a virus. This is an RNA virus. Each area of it, its attachments, its glycoprotein, its RNA, are important for its survival. Its RNA codes such things as how to replicate itself, but also some important features for its survival, including ways to disable your immune system. Each are potential targets for our scientists and doctors and nurses as we look at that. The simplest is the glycoprotein hates soap, it bursts it. Wash your hands. The other thing is its ability to survive outside of a host is limited. If it doesn't find a host within a period of time, it will die. Now on cloth, maybe that's 12 hours. On a doorknob, that might be 3 days for this particular virus. Important factors as you think about how am I going to treat, how am I going to recover. This is really what it does. It must attach to a cell, it must penetrate that cell and inject its nucleic acids, in this case RNA, and then it takes over the mechanism of that cell to replicate it until it makes copies of itself which burst and are infectious. It's important to know that the coronavirus that we are dealing with, which is a type of coronavirus, is very infectious and very high viral load. That means that people can spread the virus before they have lost enough respiratory cells that they're coughing. And that's concerning. That maybe even 2 days before they get symptomatic, they can be spreading. That's why very important testing is essential if we're going to do anything with this. Not only testing to see who has the virus, but in the years to come, who has the antibodies that will attack the virus and keep it from replicating. So this is why testing is important. And this is why, unlike many other conditions we've dealt with, isolation has become important because this can spread before we know. Previously, all other pandemics, we were isolating the sick. That made sense. This is a little different. Important to know that viruses are very specific as to the cells that they thrive in. Some viruses only affect plants, some only dogs. A dog's kennel cough will not spread to the child. The child's flu does not spread to the dog. Turns out that COVID-19 spreads to cats, but mostly really big cats. So if you have a tiger at home, be sure to wear a mask and face shield when you're feeding it. Don't feed it yourself. But it does not appear to be as common in house pets. It does, but different viruses have different environmental temperature and humidity goals. We know that the polio virus was extremely common in summer. We know that the flu extremely common in winter. COVID-19 we're not sure of because we're seeing it throughout every part of the world, including Antarctic cruises and equatorial Africa. If the virus mutates, it's been used to being in a mammal of some sort, and it mutates so it can attack a human. Then the question is, do the humans have any natural immunity to it? It may be because of a related virus shared that immunity, or it may be unrelated. When it's unrelated, it can spread widely. We think the 1918 pandemic from swine spread widely because people were not commonly associated with this. They had not seen that, especially the old and young. At that time, there was maybe some protection in the very old, because of a similar virus from 60 years earlier, but the young were devastated. It grew, it went on. It's important to remember this COVID-19 is one of many. We've been through this before. We will get through this one as well. My father survived the 1918 pandemic. He then survived the diphtheria epidemic. He then survived World War II and dengue fever and was a greater man for all of that. My mother watched the coffin of her younger brother being carried out as they were nailing the door shut to their front door with the quarantine signs, yet was a greater person. I remember that my family and neighborhood were devastated by polio, and now that is gone. I remember all of the measles epidemics, which devastated a fraction of the people that were affected. And we all have gone through swine flu, bird flu, etc. We can get through this, but we must understand the lessons learned, which include decreasing spread, increasing immune response, vaccines or otherwise, and discovering novel therapies. But the important thing is, we've been through this before. Do not be afraid of something that you can understand and you can participate in defeating it. COVID-19 probably originated in bats. It may have had an intermediate vector, which was an exotic animal. We think so because genetically the link to bats is very strong. And the actual earliest definite outbreak was in the Wuhan exotic animal market in China. It became then spread worldwide to people as a human vector. And once the human vector became important, it spread worldwide through planes, boats, and land-based spread. The earlier epidemics, 1918, etc., traveled slower. We delivered hundreds of thousands of people by planes worldwide to ski resorts in France, etc. During the process, we learned about super spreaders. One particular person at a religious large megachurch in South Korea seems to have infected a large number of people. Similar situation probably took place in Spain at a political rally. We're concerned about the effects of Mardi Gras and the large blip over New Orleans. We will learn over the next month what the effect of holding a national primary in our state was yesterday. These questions, will we break the isolation, were important. But it's important also to understand that it's not simply one point. When you genetically study California, you find 29 strains of COVID-19, meaning that there are multiple point infections. And that makes sense when you think about the way this takes place. So throughout the world, people are isolating, trying to not give it vectors while we figure out the either medical or immune therapy, because it could die out by lack of available vectors or hosts, or it could die out because it mutates. It could die out because environment and weather changes. Probably it's going to die out when we vaccinate for it. Once it infects a host, it's specific not only to the host, humans, but also to particular cells. Rabies and polio, more to the central nervous system. COVID-19, more the respiratory cells. When they do divide and take that, they block its ability to exchange air. So you can see that if a person has a predisposition of decreased lung capacity, they're going to be at greater risk and become hypoxic sooner. You can also see where the dry cough will be important. When we understand what the cells that are infected response is, you understand the fever and the other symptoms, as well as the potential for treatment. Our immune system eliminates bacteria and virus by identifying them as foreign. There are antigens on them which are foreign, and they are attacked. Our antibodies are ramped up to attack that, and that leads to other possible treatments. How can we ramp up antibodies? Well, vaccination, but also as they eliminate the virus, people began to think, well, could we use convalescent plasma or serum full of these antibodies to help treat people who are sick? This is being done experimentally now, but don't fool yourself. There's very little new under the sun. This was the therapy of 1905. It was the therapy tried in 1917 at the front end of that pandemic. It's likely to be a role, but not complete. But if you also look at how the virus must attach, enter, and replicate, each phase are part of our antiviral therapies. But each phase has to be specific to the virus. If we simply block replication of RNA, we block cell function. So that's why these drugs and treatments are not benign. That's why vaccination appears to be the real target therapy. And that's the important good news, is that there are 8 vaccinations presently in development, and some of the best minds in the world have been redirected to this very issue. That's one of the reasons we need to be confident. That's one of the reasons we need to decrease the effects of this by 2/3 in this outbreak so that we can eliminate it before the next. So if you know what cells are attacked, you know the symptoms, you know the treatment. They're going to have fever from that immune reaction. They're going to have a dry cough. They're going to be short of breath. That's why testing is so important. By ramping up testing, we can isolate quicker. This is what worked in South Korea by rapidly testing. And so we must ramp up our testing. Avid Labs is working on their 5-minute test, which will be game-changing. The fact that the University of Wisconsin developed their own test, not waiting for the CDC, means that when you come into the hospital, we can tell whether you're infected or not, isolate you properly, and reassure the OR when they're operating what's going on. That's important in the OR because in general, this virus, even though it's expelled from your respiratory epithelium, even though you cough it out, it doesn't aerosolize well, meaning it doesn't hang in the air well like measles does. This will tend to drop to the ground. That's why you stay 6 feet apart. That's why masks and face masks make sense. But those droplets on the ground last about 12 hours on cloth and up to 3 days on cabinets, etc. That's why you wash surfaces. That's why you wash hands. That's why you use personal protective equipment. And that's really why washing is such a key feature. Whether it's the stuff you get from the store, whether it's your doorknob, whether it's just hands. That's essential. Once people are infected, treatments are isolation, physical distancing. Fever is treated with Tylenol. We are concerned about many medications, including ACE inhibitors, including non-steroidal anti-inflammatories, because theoretically they could affect replication of viruses. There's no proof whatsoever. If you need the medicines, right now they say take the medicines. Treating fever, we're starting with Tylenol. Fluids and rest are important because most of us, 80%, will throw this off. They will develop the immunity and they will, for some unknown period of time, not be susceptible to this virus. If we can replicate that with a vaccine without people getting sick, this is the ideal situation. If they're severe, and that could be because their immune system's different or their lung capacity is different, people are hospitalized. And the key to hospitalization is usually hypoxia. We support their oxygenation. We try experimental treatments, and all treatments beyond what I've mentioned are experimental. There are in trials, antivirals, and other medications. When people worsen, we support them by ventilating. If we go to ventilation, we save about half the people. So it is a very severe disease, probably 30 times more severe than flu, but not as severe as the 1918 pandemic. This is not Ebola, but this is severe, and that's why people are frightened. But if they understand the steps we take to avoid and treat this, we can do it. What's the solution? We set up a situation where the virus can't find enough vectors. That's isolation. We hope the virus mutates and loses infectivity, but we cannot control that. We develop effective treatments and vaccines. How are we done with that? Well, Remember I said that if 2/3 of the people are protected, either because they're isolated from it or because they are already immune to it, it will die out. And if we do that, the process will be longer. This is the projected peaks for the world, where we're now at about 1.5 million infected. We're moving toward 100,000 deaths. And the point that's made that I want to make there is that this curve of the people being ventilated is rather sharp. And if it's sharp, you overwhelm the hospital, the hospital systems of the world. If, however, you can flatten that curve, 2/3 of the people will never get this sick, will never be hospitalized, and the 1/3 that remains will be spread out over time. A fair example of that is Wisconsin, where the curve is shifted to the right later into the spring and lower. I've magnified this graph by 100-fold compared to the other one, to just give you an idea that even with that degree of magnification, this graph, the ones that will be ventilated, is low. And we have enough ventilators in this state if we can keep them spread out in this way. We have enough beds. The rest of the world is not as fortunate. We have to remember that. We have to supply them. But our local situation is extremely fortunate because of common sense of the people of Wisconsin and the ability for us to redeploy our entire hospital to take care of this so-called peak. A surge would be if it suddenly went up and overwhelmed the system, and I'll show you where that's happening. But if we can make it a low slope and a low peak, we can take care of that. To do that, we have to maintain the isolation, and we have to maintain it well into the summer. So that's important to understand that nobody really knows where this will be. And these figures are changing. Even today, we're beginning to think that our peak is going to be in May, not in April. So it changes, but we will decrease deaths if we maintain this. We've changed everything here. Our threefold mission: protect our patients, our neurosurgical patients, take care of them, do the emergent surgery. We're doing 30 cases a week emergently. That's neurosurgery. That's what we have. People have brain tumors. Babies are born. We must take care of them. We must protect the entire team, and this is the personal protective equipment. We're very well supplied with that, and we're making our own. We could be overwhelmed by a huge surge. If we can keep it to this slow slope I talked about, we will have enough. And then we repurpose everybody to care for COVID-19 patients. We're learning everything about ventilator care. Josh is teaching us about ARDS. Our nurses are training for that, because we do not wish to be surprised. And if we plan, we can be confident. We need not be afraid. This is a fearful time, but I'd rather we be prepared and we be great. Each and everybody plays a role then. Each has a point person and is responsible to that point person. It could be the clinics and patients where we have repurposed thousands of patients. We have to keep track of them. Doctors and APPs and secretarial staff are absolutely essential. We have hundreds of people whose ORs have been postponed. They're going to get sick. We have to find them before they do and bring them in and do them urgently before they become emergent. This is a big strain. We need everybody confident and working to do that. We've completely repurposed our ORs. The neurosurgery ORs have been repurposed because of their size and air handling to COVID ORs. We're working in other rooms. We're doing just fine there. We've repurposed our inpatient units. The neurosurgery ICU was the best ventilated one, so it has become the COVID unit, and we are sharing an ICU with cardiac. We're doing fine. The care there is excellent, but people are frightened because they're not sure where equipment is. We're training every day. We will get through that, and people will be protected. We're rounding differently. We're sending residents home immediately. We're not bringing people into the hospital unless they're essential. And research and education continue. It's very important what you're doing. Our base mission will continue. People will be sick. Neurosurgical problems, stroke, brain tumors will continue. We cannot interrupt that care. and we can do greatness during a time of social isolation. History is really clear on that. During the plague, the Globe Theater was closed. Shakespeare wrote Lear during the plague. So if you're writing a paper, I want that quality. Isaac Newton was sent home from Cambridge again during plague. He wrote calculus and discovered laws of gravity. And John Keats really identified what a quarantine is. Quarantine is an Italian word, 40 days. If you were on a ship during an outbreak, you were quarantined in the harbor for 40 days, just as they are doing in some countries with the cruise ships, until it was clear that there was no further disease on your ship. That, of course, meant that they expected the people to pass on the ship. Keats arrived in Genoa during typhoid fever, spent 40 days writing on the ship. So greatness is possible. This is what we're trying to do. If you look carefully at these curves, this is the curve of Madison. It's very low. When things have not been controlled properly, or people live too closely together and it's unavoidable, or there have been mistakes as far as isolation, such as continuing sports, continuing rallies, there have been remarkable increases. This is what the Italian increase was. Look at New York and how New York rose so rapidly that sudden increase, that's the surge, overwhelmed their healthcare system. And look at New Orleans, how much that is rising compared to the others. This is what happens 4 weeks after Mardi Gras. And so that's what we're trying to avoid, because we can't handle surges like that. We can keep it low. That means everybody is playing a part in this worldwide. That's why you now do not see people on the streets in Dubai. You do not see, and you see early attempts at this in the equatorial world. So we're doing very well. These protections will decrease infections and deaths by 2/3, but it's going to spread the whole process out well into the summer. I have faith in our scientists regarding the vaccines. I do believe that they will be able to interrupt any second or later surge. We must maintain ourselves physically and mentally at this time. Now, we're very lucky. We live in a magnificently beautiful state, and it's spring. And unlike some parts of the world, we are allowed to exercise outdoors. Some parts of the world and this country are not allowing that. I'm glad to say we do, because it's part of your health. The sunlight's important. The mental health's important. I want people to be active. I want them out. I want everybody to realize that while you're not in the hospital, you're working. Teach, write, prepare grants and papers. And the most important people by far are nurse practitioners. Keep track of our postponed patients. Our work goes on, and it is essential work. Look after each other. This is my favorite picture. This is the nurses' face shields, all labeled and boxed. Viruses die in the bags over the next 12 to 72 hours. And this is where their break room is. This is my daughter. She is a professor. She's teaching online on her lectures, but in the rest of her time, she's looking after the elderly people. She's basically made herself a Meals on Wheels person that delivers food to the isolated elderly who are alone. Look after people. Are they having contact? Are they taken care of? Loneliness is a dangerous thing. We are not alone, and that's important. Do exercise. This is an absolutely beautiful town. Get out as long as we are allowed to. My wife is basically calling up people that she knows are alone and saying, you will meet me at the Arboretum, 6 feet apart, we will take a walk and hike, and we will stand there. Social, that's important. We can be inventive. Online, we can do many things. Online book clubs, crafts, play or discuss music, exercise teams. I want the department to gather in this way. I want people to champion this, to work with our IT people. This is part of my extended family. We cannot gather like this. But this weekend, we had on Zoom probably the worst rendition of Happy Birthday ever recorded, as everyone from around the country gathered electronically to wish one family member happy birthday. That's important. It changes lives. It keeps us healthy mentally and physically so that we can care for patients, both with COVID-19 and with neurosurgical problems. And we can do the research so that the people of the future are not lost because of this. We are in it together. We're very lucky to be well prepared. We're very lucky to be in a population which is sensible. They're taking protective steps. We are part of a magnificent medical center that's mobilized to meet this and other health problems. Continue your work. It is essential work. Very, very proud. Much will be learned from this. The thing I'm learning right now is how proud I am of everybody, staff, administrators, nurses, secretarial, doctors, but most important, our patients. They understand why they're postponed. They understand that they must isolate. Take care of yourselves. Be proud of what you do, and thank you for everything you do.